I was a new nurse with 1 year and 6 months of experience, and I recently moved to coronary care unit. It was Monday morning. I had a patient going for a pacemaker early in the morning. I never worked with a patient going for this procedure, and I didn't know how I need to prepare such patient. It was Monday morning, and the air in the unit felt a little heavier than usual. My patient was scheduled for a pacemaker insertion early in the morning, and I was assigned to prepare them. A wave of nervousness crept over me. I had been in nursing for 1 year and 6 months, but this was my first time handling a patient going for this specific procedure. I stood outside the patient's room for a moment, trying to recall everything I had learned in training. My mind raced with questions. What pre-op steps do I need to follow? Is the patient allowed breakfast? What paperwork needs to be done? Should I remove jewelry? As I walked in with a calm smile, masking the butterflies inside, I realized something. This wasn't just about following a checklist. It was about making the patient feel safe, even when I was unsure myself. That morning taught me more than a textbook ever could. I was in a room when they entered, and I didn't see it until the surgical nurse called me at 6:30 and asked if I had followed the doctor's orders and had an IV in place, as well as shaving and scrubbing. I told her we would go and get them done now, and that he already had a 20-gram IV in place that I verified as patent. I asked her if I could do anything else, and she just scoffed and hung up. I expressed multiple times to my supervisors and the surgical nursing team that I was brand new to this and wanted to be sure I had everything done. Charge nurse came to help since we were having issues getting supplies, critically low, no razors or scrub available. She said that if we didn't have it, they could do the scrub in OR. The mean nurse arrived from surgery with a second nurse then and began to tell me that I was going to be in a lot of trouble with the doctor for not having the patient prepped. Then she walked in the room, grabbed the patient's arm, and began to scream at me that this IV would not work because it was in his right arm. This time, the patient and family were panicking and afraid that the procedure would not happen, since she said, "You didn't follow direct orders, and now he isn't ready for the procedure." The secondary surgical nurse took me aside and told me they usually do the scrub in the OR anyway, and the other nurse is always mean to everyone. She isn't a morning person. I don't know why the IV isn't okay on the right, but the order didn't specify. Later, my charge filed a complaint with my manager saying that it was totally unnecessary and panicked the patient for no reason. I always try to be calm, but I ended up sobbing after they left because I've never been spoken to that way by a coworker and felt so bad for the patient who was nervous. I can handle any kind of angry patient, but I expect respect at work. I didn't know the IV needed to be in the left arm. I had him dressed in a gown with a functional IV and MPO, waiting for the only electric razor we had to come available. I feel frustrated because I don't know what I could have done differently. I was asking my charge for help the whole time and she was doing her best. I tried calling back to ask for clarification, and I can't help the razor had vanished. I was ridiculed in front of my patients. I decided to leave the profession. Many years passed, I joined the pizza shop for my living and started delivering pizza, but still, I did not forget my insult. One day I received an order slip with a name Ironica mentioned. I took my pizza delivery and went to the address. I rang the bell. I was shocked after seeing the lady. She was the same lady who insulted me once. I was a nurse. I recognized her, but she couldn't recognize me due to my pizza delivery address. I was furious again after seeing her, and pizza fell from my hands. I collect the pizza and hand it over to her. Luckily, it remained inside the box. I left the house to the pizza delivery shop. I couldn't sleep. It was a 3-hour day today. I decided to take my revenge of my insult. I went to the old market and find a person with a snakes. I bought a poisonous snake of small size. I came back and went to my duty. I ordered large-size pizza for my home. I came back early that day. I put a snake in the pizza. Snake bite the pizza. I thought the pizza are full of venom. I delivered the pizza to her house by saying, "Her, that your last pizza was contaminated, so we decided to deliver you another pizza." I left the house. I knew that she'll be dead after eating the pizza. I was happy and contented that day. When I reached the house, I slept on the sofa. That snake was out moving in the house. I was sure the snake had no more venom. As I slept, I screamed, "Something has stabbed my foot." It was that snake. I called the emergency. After that, I got fainted. I was sure to be dead. As I reached the emergency, I was treated. My venom was removed. I was given different medicines. I was kept in ICU. When I opened my eyes, it was the same nurse whom I tried to kill. I recovered well. She take care of me well. We agreed not to be enemies further. She apologized with me about her old behavior, and I also apologized her for my acts. I again joined the nursing profession, and we worked together further for the care of patients.